Hi, my name is Adekunbi Oyaronbi, and my participant's name is Carly. Today, I am demonstrating a 3-site skin fold on a female. The 3-site skin fold is used to estimate the body fat percentage based on the skin fold measurement taken with the caliper. Based on the gender, the body sites are different. For a female, the first site is the tricep, which is a vertical fold on the posterior midline of the upper arm that is halfway between the acromion and the olecranon elbow process. To perform each measurement, using the tips of your thumbs and the forefinger, pinch the skin in the area to be measured, asking the participant to flex. Pull the skin away from the muscle, being sure to get all the fat underneath the skin, but do not include muscle. Measure the thickness of the fold of the fat and skin in millimeters with the skin fold caliper. Release the caliper handles and wait 2 seconds before taking the reading. Take a reading of that same site a few more times and then take the average. The second site is the superiliac, which is a diagonal fold superior in line with the angle of the iliac crest. Gently press the area and find the ridge of the hip. From here, you will follow a vertical line until you hit the hip bone. The skin fold is angled in 1 to 2 centimeters right above the iliac crest. In order to get the best and the most consistent measurements, all skin folds should be taken on the same side. A minimum of 3 measurements should be taken at each site to obtain the average. Make sure to maintain the pinch while reading the caliper. The third site is the thigh, which is a vertical fold on the anterior midline between the upper knee and the inguinal crease, the crease where the top of the thigh meets in the hip. You should pinch the skin a little harder because the fat and the skin tissue are made of the same area. This is my participant, Chantalise. Today, my participant will be demonstrating a 1RM testing protocol. First, you will have the participant warm up with a light resistance that easily allows 5 to 10 repetitions. You will now estimate a warm-up load that will allow the participant to complete a 3 to 5 repetition by adding 10 to 20 pounds or 5 to 10% for upper body exercise. These steps will be repeated for the participant, so a near maximal load that will allow the participant to complete a 2 to 3 repetition by adding more weights. After, you allow the participant to rest again for 2 to 4 minutes. You will now make the load increase again 10 to 20 pounds. Then instruct the participant to attempt a 1RM. A 1RM testing protocol is used for assessing the strength capacity of a person. A 1RM in weight training is the maximum amount of force that can be generated in one maximal contraction. Then you now will provide another 2 to 4 minute rest and increase the weight again. If the participant was not successful, you will decrease the load by subtracting 5 to 10 pounds. You need to make sure you continue increasing or decreasing the load until the athlete can complete a repetition with the proper exercise technique. The participant with the 1RM will be measured within 3 to 5 testing sets.